Now, in majority of the cases, we really don't know why patients develop MDS. It's thought to be a process of aging, senescence of the hematopoietic stem cells, different environmental factors. There are certain things linked to MDS. There is definitely a genetic component. There are like certain familial syndromes that will put patients at increased risk, but those are very, very rare. So there is something like familial thrombocytopenia syndrome, where patients would be carrying a germline mutation of the RUNX1 gene. This is an autosomal dominant inherited. Half of the carriers will eventually develop MDS. But those are rare. If there is a strong family history, I think, periodic monitoring of the blood counts, but there is no intervention to alter the natural history for that. In terms of exposure, I think benzene exposure and chemical exposure is known to cause MDS, and this is pretty much regulated nowadays. However, one of the sources of benzene exposure is in tobacco use or in cigarette smoking. So definitely there's some association between smoking and increased risk of MDS. So if somebody wants to look for a preventive measurement, I think smoking cessation could be potentially one. Finally, we talk about therapy-related MDS, which is MDS we see in the setting of treatment with chemotherapy or radiation for other diseases. And there is a subset of patients that vary based on the chemotherapy that could range from 1 to 15% that will develop therapy-related MDS as a sequelae from the treatment. And we used to think that this is mainly related to stem cell damage, but we are learning that there could be some predisposition for that patients could have a very small clones of P53 mutation. But so far, even that did not translate to have preventive measurements. Maybe in the future, hopefully, if we can better identify those patients, we can tailor the therapy to try to avoid treatments that are known to cause therapy-related MDS, or at least have closer observation. On the patient side, I think, probably smoking cessation and just healthy, balanced diet and, regular exercising. The general recommendations that we make for any patient is what a patient can do, or, but in terms of preventive measures that, somebody can modify their lifestyle, there is really not much nowadays.